Hello, this is Louise. I'm doing a video discussion with Dr. Ramona Wong. She's a retired nephrologist in Honolulu. A nephrologist is a doctor who specializes in kidney disease. Dr. Wong also runs a class of extremely informative workshops for people with chronic kidney disease, which of course are on hiatus because of the pandemic. So we thought we'd try a Zoom discussion to get some information out to people. So hello, Dr. Wong. Thank you so much for doing this with us.
Thank you for having me.
Okay. I've also heard that there's a greater incidence of kidney disease in Hawaii and specifically among Native Hawaiians and Pacific Islanders. What can you say about that?
According to the United States Renal Data Service annual report, so the United States, the USRDS is what it's called. The USRDS publishes the statistics for kidney failure for the nation, and they collect all the information from each state. So according to the USRDS, the Native Hawaiian Pacific Islander population, comparing ethnicity to ethnicity, they have the highest rate of kidney failure. And for that reason, it's even more important to me that we educate that population about what they can do to prevent it, or to slow it down, or at least just to even realize that they're at risk.
So is there any data that could tease out if it's due to lifestyle, diet, genetics? Is there any understanding of the causes for that increased incidence?
When there was a local study done by Marge Mao, Dr. Mao, and a few and other doctors locally, and when they looked at why, it was not anything sexy. It's diabetes, largely diabetes, high blood pressure, and so it again may kind of indicate a genetic sort of predisposition to becoming susceptible to these disease processes and being higher in the Native Hawaiian Pacific Islander population. And so perhaps for them, even more so, a Western diet, a standard American diet or whatever, is even more toxic given their genetic, hand that they're dealt. So, back to basics, and Dr. Shintani had created this Y&I diet at one point, and it was really very um, basic, back to basic, largely plant-based, and less processed foods. I think that is probably good for most of us.